YouTube. I'm Marissa.
I'm Connor.
And together we're
Carissa. One of the biggest misconceptions that we run into when talking about our marriage and our relationship and the fact that we both work and still use caregivers is that we don't qualify for public benefits or that caregivers are paid through insurance. The latter is kind of right, but we're here today to really dispel that notion. It's a very complex subject, and we are by no means experts. To start, we should probably talk about how caregiving works in a home setting. There's two types of caregivers that I use. Those are home health aides, which are unskilled caregivers. That's a technical term. It doesn't mean that they don't know what they're doing.
Or don't have any skills.
Or don't have any skills. It just means that they are not licensed medical professionals and they're only performing helpless activities of daily living, which is essentially helping with food prep, helping with dressing, bathing, bathrooming, nothing of a complex medical nature. Then we have skilled care, which is in the form of actual nurses, so LPNs or RNs. Typically in home settings, it's through LPNs. Private insurance unilaterally will not pay for home health aides. They've collectively decided that anyone performing mainly activities of daily living is considered custodial work and therefore not medically necessary, and therefore they don't pay for it. In 2024, the median cost for home health aide care was approximately $78,000 a year, none of which would be covered by insurance. Skilled nursing is generally covered by most private insurance companies. However, they only cover a portion of it. Usually it's limited to 2 hours per visit and up to about 20 visits per month. So that means only about 40 hours per month will be covered. So how do we get that paid for without paying for it ourselves? Really, the only game in town is Medicaid. Medicaid is federally funded, federal program through the Social Security program, mainly on SSI, so that's Social Security income. Most recipients of SSI qualify for some type of check per month in addition to Medicaid coverage. SSI is different from SSDI. Those receiving SSDI do not qualify for Medicaid generally. They're all dual recipients, but that's a whole different ballgame. Qualified for Medicaid at the federal level is much more restrictive. It's a means and asset tested program. Typically, you have to make under a certain amount and have less than $2,000 in countable assets. That means kind of anything that you own, from cash, jewelry. They don't count the home that you live in, but if you have more than one home, the second home will count as an asset. And, as you can probably imagine, $2,000 is not a lot to have in your savings account. That hasn't been updated since 1989. So if you were to increase 2,000 for inflation, it would probably be a bit more today, but honestly, it would still probably be restrictive. They do increase it to $3,000 if you're married, but big whoop, extra $1,000. State programs kind of differ by their eligibility criteria. I would say that some are fairly lenient compared to others. That said, it is, in my opinion, more beneficial to keep your federal SSI eligibility because then you can move state and that supersedes the state eligibility. So, how do I maintain Medicaid eligibility while married, while working? It's a complex question. The answer is known as 1619B special exception rule. Now, this is a very niche rule that not many people know about, including Social Security employees. So, if you are disabled and you receive SSI or you receive Medicaid and you want to work and you want to get married, you can do it. And this is how. 1619B is a way to continue to qualify for Medicaid even if you're working, even if you exceed the state threshold limits. And here's how. You have to be eligible for SSI cash payment in the previous month that you're applying for 1619B eligibility, and this is kind of important because it creates sort of a catch-22 system if you ever lose 1619B eligibility. The next piece of eligibility is to still meet the disability requirement, which that's an easy one. You have to still meet all other non-disability SSI requirements. The big one here to mention is the asset limit, meaning that although the income limit is sort of taken care of by this rule, the asset limit still remains, so you still need to watch how much assets you or you as a married couple have. You need Medicaid benefits to continue to work. That is sort of assumed. And that you have earnings that are insufficient to replace your Medicaid and publicly funded attendant care. And this is the big one. Because this means that you can make as much money in the world as you want. But if that money can't replace what Medicaid is paying for your care, then you can continue to qualify. So, for example, in the state of Pennsylvania, I think the threshold limit is about $50,000. So if you make in excess of $50,000, you're not eligible for Medicaid. However, if Medicaid is paying, say, $200,000 for your care, which for some medically complex cases that involve home health care, skilled care, that is entirely possible. If your cost of care is $200,000, you can make up to $250,000 per year and still qualify because your income subtracting your cost of care, which is $200,000, leaves you at $50,000 or the threshold limit. So you really need to be cognizant of what your yearly cost of care is. Now that threshold limit that we're talking about, this is another complex piece because that's an individual threshold limit and not many Social Security agents know that exists. So you really have to show them the rules the 60/90 rules, and the individual threshold calculation, which I will link you to below, because if you're having a reconsideration meeting with your Social Security agent, you really need to bring this to them. This would be the SI 02 302.050 PALMS individual threshold calculation. See the link below. So now that we've talked about income, let's talk about assets. Assets are a little harder, and we've struggled with that quite a bit. Our combined income is not above my individual threshold limit, and honestly, it's not really anywhere even near it. So we have to get some big raises before we have to worry about income. But assets, that's a little tougher. Our asset limit is $3,000 as a married couple. It's not a lot of money. The easiest way to shield your assets is with an ABLE account. Every state has their own version of an ABLE account, each with different benefits, but generally the benefits are that any assets are not counted against you for Medicaid eligibility. The downside is you can only input up to the IRS gift limit for the year, which I believe is at 20,000.
I think it's at 20,000, yeah.
So in 2026, you can put up to $20,000 into this account. Another downside is that it technically can only be used for disability-related expenses. I'm not an expert, not a lawyer. I can't make recommendations to you. I can just tell you what I've experienced, and I've never been asked to prove that expenditure was for a disability-related expense. In addition, one of the things that you can use these mental health related issues, and they did that on purpose when they wrote the bill, because it leaves to interpretation what counts as mental health. You could argue that a vacation to Tahiti is for your mental health, that buying a Nintendo Switch is for your mental health, that buying your car is for your mental health. The next shielding technique is a special needs trust. I highly recommend you work with a asset planner. They're very complex and not to be taken lightly. They really restrict how you can use assets, but done correctly, they're a strong tool.
Yeah, not to be confused with family trusts or irrevocable trusts or revocable trusts. Special needs trusts are their own.
Although it is a irrevocable trust.
It is an irrevocable trust, yeah.
But yeah. And then another tool are retirement accounts. We have to put an asterisk next to this because Social Security does look at retirement accounts as assets if they are accessible to you, even if accessing them causes penalties. However, depending on your retirement account, they might not be accessible to you at all. So putting assets into those accounts could be a way of shielding them at least until your retirement. That said, we as a couple had to kind of make choices about how to shield our assets, what to put in ABLE accounts, what to put in special needs trusts, what to put in retirement accounts, and really, consider when funding and assets would be needed by us, and tying up resources and accounts until our retirement versus in special needs which may not be readily accessible, versus able accounts, which are more readily accessible. It really comes down to what your lifestyle is and what your goals are. All this is to say, you can get married, you can continue to work, and shield your assets. Now, why does this matter? I don't really follow the news a whole lot. I'm not very political, at least, I don't know, am I political?
No, he's not political.
Recently, there's been a lot going on in Congress about the federal budget. I'm sure you've following the shutdown that happened in November and the one that happened yesterday. As I film this video, I don't even know if it's still going on. That's how little I pay attention. But what I can tell you is that the recently passed reconciliation law reduced federal Medicaid spending by an estimated $911 billion between 2025 and 2034. That's already a 14% reduction in federal spending for the program, which puts a large onus on states to make up the difference. During the last major reduction, 40 states reduced home health care by serving fewer people. 47 states cut benefits or payment rates for long-term care providers. KFF, which is an independent source for home health aid policy research, recently sent out a survey asking every state how they would react to the reconciliation bill if it were passed. 44 said they would constrain spending to limits on either total enrollment or total spending. 34 also said they would cap spending per participant. 44 reported using mechanisms to further restrain spending, such as limiting the amount of spending per service or per participant. 15 reported planning to adopt new strategies in the coming year to further cut costs. Now, it should be noted that survey was sent out prior to the reconciliation bill being passed, so it's anticipated that more states are starting to adopt new strategies to limit home health care costs. I also want to point out that the only state that did not respond to the survey, should we make them guess?
Sure. Put your comment down below with the state that you think didn't respond to the survey.
It's Florida.
You can't tell them the answer.
Well, when are you going to find out? Maybe we'll cut this. We'll see. So why does it matter? Our lifestyle is supported by the fact that I have outside home care. We would certainly not be as strong of a couple, in my opinion, if we didn't have that. I think it would put too much restraint on our relationship.
And also the independence of each other as a couple.
Absolutely. And I don't think we would, I think we're both fairly independent in our careers, and that would have to change.
Mm-hmm.
Also, we don't have children yet, and when we do have children, sure, if I lost home care today, you might be able to step in and help out for a bit. We would make it by, but with children, it would be untenable.
Yeah, I mean, I think it would take major, couple choices.
Yeah.
And strategy on our end.
And, we are a strong couple and fairly well off. So there are choices that we have that we can make that not many people do, which is a statement on our society, in my opinion, that So a lot of people out there right now, they're very scared to lose the care that they have and what this means for them. So it's important, and not to be Debbie Downer here, but these are things that not many people are paying attention to or don't realize that private healthcare doesn't really help out disabled people that want to live independently. And the only game in town is Medicaid, and Medicaid is being systematically targeted. So it's very tough for people. Any uplifting things to say?
Wow. Just put me on the spot for uplifting things.
I'm the Debbie Downer here. You gotta lift it up.
I mean, yeah, I don't got anything.
No?
Yeah, nothing on my end.
Okay. Sorry for being the bearer of bad news to everyone. Well, no. I guess it's good news.
I mean, some people would not have known about 1619B.
Yeah. We share the knowledge of it, it's possible to work and receive benefits. I really want to end this. Yeah.
So we don't know how to end this video. So thank you for watching. And I'm sorry that Connor's a Debbie Downer today. He's usually not. So look forward to our future videos. Thanks for watching.